thank you for coming. I have to hold this up because we are being streamed, but there's no amplification in the room, so hopefully my voice carries and you can hear me okay. You getting that sound okay? Fantastic. So, just waiting for another couple of people just coming in just now. Just let them get settled and then we can get started, if that's okay. So, welcome to the next of this Scottish Ecosystem for Innovation. This is a wee bit of an experiment for us as well. Normally we have a kind of single session when we're doing these things, and we run it in a morning over 3 or 4 hours. So this is a little bit of an experiment for us. Hope you're enjoying the Citizen M experience. For those who haven't been here, we liked the space. We thought it was quite creative, get people thinking a different kind of way as well. So we split it into 2 sessions. So we've got 50 people approximately in the morning and 50 people in the afternoon. So timing is actually quite important for us. So apologies for rushing you in and corralling you in. We'll give you plenty of opportunity. The main meat of what we want to try and do is get your thoughts and views and interactions around the whole life cycle and world of dementia technology and services. And so look for your participation in that. My name is Brendan Faulds. I'm the Chief Operating Officer of the Digital Health and Care Institute. We host this event, but we're part of a wider group which I'll talk about in a little while. If I just move on quickly, I've got some housekeeping stuff first of all. So fire exits, follow the green signs, follow the screaming DHI people to the exits out that way, and you'll follow the signs when you see it. There is no Wi-Fi code as such. There's free Wi-Fi for anyone who wants to use it. It's just connect to Citizen M. There's no password there. We are filming this and we're streaming it, so if anyone doesn't want to be recorded in that or covered in that, please talk to anybody in the registration team if that's okay. And you can follow all the activity on Twitter, and there's the hashtag and stuff at the bottom there. Refreshments, we will have refreshments in the workshop area, so whilst you get a cup of tea and a cup of coffee here to start with, when we move into the coffee break and the workshops, there are refreshments in the workshop, so just go straight to your workshop room when we get to that point and pick up a bit of refreshment there. I want to thank all our exhibitors today in advance for their support. Please spend a bit of time with them when you can. There's a few opportunities during the morning for you to be able to do that. And find out about some of the latest innovations and technologies that are used in this area. In terms of the programme for today, very, very, very quickly, I'll take you through. It's all on the back of your badges, and you should have your workshops that you've signed up for on your badges as well. If you haven't, again, just please talk to somebody in the registration team who'll be there all day. So we're moving into some plenary sessions. We've got 3 main speakers before we go into the workshop space. Thankfully, you'll not be hearing too much from me. I'll do a little bit of an introduction and a welcome and a bit of background. But the first session is slightly different from what I think you have in your programme. First section will be around dementia and health, which will set the scene a little bit with Barbara Sharp. We'll then follow that up with Joyce Gray, who'll talk about caring for someone with dementia. And finally, Paul Flavin from Motec will talk about technology and innovation in dementia. So that's the sort of sequence of the 3 plenary sessions. We'll then move into a set of workshops. And again, you should hopefully have signed up to all of those. If you haven't, again, speak to somebody in the registration team. We'll get that sorted out. There are 3 workshops around the subject of dementia. And the dementia services and caring. There are another one about DHI in terms of its process. We're keen to learn all the time about how we can improve what we do and how we do it. So again, if you're interested in that, you can sign up to that. And there's a final one around enterprise support and commercial support from a business point of view. So again, if you've signed up to that's another good one for your own benefit, and also from our benefit as well in terms of what we can do differently or more to help businesses develop and commercialise. We'll then have a bit of a review after the workshops. And then we'll move into another plenary session back in here with David Berry, who's going to talk about, from the Scottish Government, who's going to talk about the National Dementia Strategy. And then from my own point of view, just a 10-minute update on the sort of broader ecosystem piece, which again I'll touch on as part of the introduction. I'll give you a bit more of a flavour of what's going on in the rest of Europe and worldwide around sort of connected health ecosystems. We'll then sort of cover next steps, and then we'll move into lunch. So about 12:30, and lunch will be served just outside. And at the same time as you're having lunch, there'll be the next group will be coming in to register and do that. So it'll be a busy place. So again, great opportunity for networking, seeing what's happening from an exhibition, an exhibitor point of view, and just sharing your stories and sharing your experiences. Don't give too much away to the next group. We want this to be just as fresh for them. So to be fair, if you'd come in the afternoon, it'll probably be better than this ramble that I'm doing this morning. But we'll see. I'll let you know. I'll let you know. You can please feed that back in terms of the evaluation stuff that I mentioned. So moving forward, I've got two things I need to press here when I'm moving forward. So what is the ecosystem and why is it? So it was formed in 2014. And we, Digital Health and Care Institute, were kind of instrumental in kicking that off, and that coincided with us starting up as an organisation. But these days it's a different thing completely. We have all of these organisations supporting and facilitating the community, and it really is an innovation community, and that's what we mean by ecosystem. So we have all of these organisations involved. We're also members of the ECH Alliance, which is European Connected Health Alliance, and that's the thing I'll talk about a little bit later in terms of what that means and what I'll tell you a little bit about the organisation, but I've got a broader update in terms of the activities of the European Connected Health Alliance as well. DHI is all about innovation in the world of digital health and care. We are keen to support innovation, keen to support the development of technology solutions that help people and help carers look after individuals in the community or at home, as opposed to the hospital or even the primary care environment. So that's, in a nutshell, that's what we're interested in. We've targeted various priorities set by the Scottish Government, and this one is the cycle we're in just now focuses around dementia, and I'll explain a little bit later on about the sort of next steps that we envisage after this event. So today is all about, I suppose, understanding the challenge, understanding where technology can help support it, having some conversations around where people could possibly work together to start to develop and think about innovative solutions that can change outcomes, change how we deliver those services, and shift the balance of care back into the community and the social care side of things. So why did we do the ecosystem? I've lost my page now. So yeah, as I mentioned, we're all about creating this community and pulling this together. We bring academic, industry and civic members together. What I mean by civic members are the health systems, the health boards, the local authorities, but also, just as importantly, those third sector, voluntary carer, patient group organisations who are absolutely at the core of delivering much of the social care and community services that are important. So we are very focused on forming those collaborations of groups of people, and we know that if we engage people from these three different areas around academia, industry or business and the civic world, we know we've got a better chance of creating the right products and the right services that people will buy into and engage with and actually get the benefit from. Very quickly, just to mention the European Connected Health Alliance again, we are part of something bigger. Whilst we're doing this in Scotland, and that's quite an achievement to actually do this in something which is Scottish-wide. We are a member of the ECH Alliance, which is an international network. There are 25 plus ecosystems either in place or developing across Europe and worldwide. We've actually got there's actually one in North America, in New York. There's one just about to be launched in Canada, and there's one in China, of all places. Again, all very strong emerging markets around connected health. And connected health is a sort of broad term that I would say covers digital, mobile, e-health, all of the kind of technology areas that people have created, or market areas that people have created. So it is all about connecting people with their health and their health systems. So again, look at very, very similar aims in terms of a networking point of view. But as I say, I'll tell you more about them later. So why dementia and technology services? Again, a lot of this was kind of explained in the kind of welcome pack as you signed up to the event. But we have an ever-increasing number of people diagnosed with dementia. Our systems are not only straining for sufferers, but also for those delivering care. Very, very significantly a real challenge for folks in terms of that. And again, at DHI, we recognise that it's not just about, understanding the technology. It's about how that technology is used. Does the knowledge exist? Do the skills exist? Does the experience exist in the people who are going to be using the technology to actually get the best out of it for those that are suffering from the condition? Again, so it means a lot of careful planning and preparation to make sure we get the correct care, and obviously looking forward with the changing demographic, more people living longer with more conditions and multiple conditions, that can become quite challenging. So more and more, again, part one of the key aims of Digital Health and Care Institute is to focus on that patient-centred rather than condition-centred care as well, which is vital for me. Selfishly, I want that for me, and if we're in this for nothing else, be in it for yourself, because you're if you're not already in that situation, you will be in that. You could likely be in that situation going forward. So the model has not changed significantly for years, and there's an increasing need for improvement. So the ecosystem, we're aiming today to understand current challenges, explore what existing services are there, and get a kind of understanding or comment. There'll be people in the room who are not as aware as you of what is out there from the lens that you're looking at this through, and you'll all look at this from different lenses. So it's about sharing some of that in some of the workshops, but very quickly moving on to where could innovative technology, and you may have some great idea, you may have a great product, you may have some experience of what would make a difference. So we want you to share that, and things that mean better outcomes for patients and citizens. And then ultimately stimulate collaborations that can turn these innovations into realistic solutions. So really that's what we're about. It's about starting the conversation, starting the potential of understanding and focusing in on what could make the biggest difference, and then looking at how we can collaborate or join people up to work together. And what DHI then does is we will go through a process, and we'll select the ones that are best fit for us. We'll signpost others to elsewhere, so that nothing gets lost. That's important. And ultimately, we've got funding available to fund the academic part of or the academic evaluation of these projects as they come to fruition.